Hello, my name is Stephanie. I'm a physiotherapist at Flinders Private Hospital.
Hi, my name is Carolyn. I'm a clinical nurse on the orthopaedic ward.
This short video will outline information and exercises to help you prepare for your total hip replacement surgery. Please remember that the information contained in this video is general advice only for a routine total hip replacement performed via an anterior approach, that is, an incision at the front of the hip. You should always follow any specific advice and instructions given to you by your surgeon. During the surgical procedure, the worn out parts of the hip joint are removed and replaced with a prosthetic joint. The acetabular cup forms your new hip socket and is embedded in the pelvis. The metal ball replaces the top of the thigh bone. The shaft attached to the metal ball is inserted into the hollowed out thigh bone. The hip must be dislocated to allow the hip to be replaced. Therefore, all hip replacement procedures carry a small risk of future dislocation. To reduce this risk, it is advisable in the first 6 weeks to avoid extending your operated leg backwards behind you. No muscles are cut during this operation, and so the goal is to move as normally as possible. You are allowed to bend your operated hip as far as comfort allows. You are encouraged to gradually increase your walking over the first 6 weeks, and most people can aim to be walking about 1 kilometre by 6 weeks after the operation.
Now that your surgery is scheduled, we will commence gathering your medical information. Please complete any paperwork, including the patient health questionnaire, and return to the hospital. You will receive a phone call from a nurse at the hospital or doctor's rooms regarding your medical history, social history, any medication you may be taking, and discuss any preoperative testing that may be required, including blood tests and anaesthetic reviews. It is also an opportunity for you to ask questions. Plan ahead. You may wish to freeze some meals, organise assistance with shopping, any household chores, gardening and transport. You could also move kitchen and food equipment to a convenient height. Closer to your admission to hospital, you will be given an admission time to present to reception. You will be given a fasting time. This means nothing to eat or drink. Please refrain from smoking or chewing gum. On your day of admission, please bring all your medications in their original boxes. Recent applicable x-rays if you have them. Any medical equipment you use, for example, CPAP machine or insulin pumps. Your clothing and nightwear should include loose, comfortable fitting garments. We encourage you to dress in day clothes the second day after your operation. Shorts, t-shirts, skirts are appropriate. Good fitting shoes and or slippers with heel support, no thongs. And personal toiletries. Please do not bring any money or valuables. If it is a requirement of your admission, please ask for it to be locked in the safe. You will be taken to day ward where a nurse will complete your admission. You will change into a hospital gown. Your belongings will be locked away and delivered to your post-operative ward on your return from theatre. You may see your anaesthetist in day ward or in the theatre area before surgery. When theatre is ready for you, you will be taken to the theatre area. Your name and personal details will be checked. Waiting in theatre holding bay is routine and gives your anaesthetist and surgeon an opportunity to see you just prior to your operation if necessary. Your anaesthetist will discuss the best type of anaesthetic for you: general anaesthetic, spinal anaesthetic, or regional nerve block. Please be aware if you do have a block that following your surgery, you will notice your operated leg is numb and won't move. This is normal and sensation and movement into your limb will return. On the completion of your surgery, you will be cared for in the recovery unit. This is where you will wake up and be closely monitored and any pain managed prior to returning to your ward. Some patients may spend the first 24 hours in the critical care unit for closer observation. This is determined by your anaesthetist. You may have an oxygen mask over your mouth and nose. You will have a drip in your arm. You may have a drain coming from your wound. You may have a urinary catheter. You will have compression stockings on and inflatable sleeves around your legs or feet, promoting blood flow and preventing blood clots. If able, we encourage you to pump your feet regularly to assist in blood flow and to do regular deep breathing and coughing to keep your chest clear. It is important to note that these attachments don't stop you from moving, walking or getting out of bed with assistance from the staff. Following your surgery, you will have pain. It is important to take regular pain relief to remain comfortable. Your nurse is there to help you decide and offer guidance as to the best regime for you. You will have access to different forms of pain relief. We encourage the use of regular ice packs, regular simple pain relief such as paracetamol and stronger narcotics when required. As pain is greater on movement, you should assess your requirement for analgesia based on when you do this. I also suggest timing your analgesia before physiotherapy visits, as this will help you get more out of these sessions.
Early movement of your hip and standing or walking is the key to a speedy recovery. Our aim is to assist you to become safe and independent as soon as possible and to get back to an active lifestyle. It is important to remember that people progress at their own rate depending on many factors, but the majority of people are safe to discharge 3 to 4 days after their surgery. Your physiotherapy will commence either the afternoon on the same day as your surgery or the following day. Depending on your surgeon's preference and the time of your surgery, we may assist you to stand and take a few steps on the day of your operation, as long as you are medically well. We will advise you regarding your exercise program, which you will continue to practice regularly throughout the day. The day after your operation, you will be assisted to get out of bed, walk with a frame, and sit in the chair. Over the next 2 to 3 days, we will be aiming to improve your walking, and we will advise you when you are safe to become more independent on the ward. We will be aiming to increase the distance that you are walking each day and progress your walking pattern and gait aids as you continue to improve. Once you are safe walking with a frame, we will aim to assist you to start walking with a walking stick. Before you go home, you will be shown how to safely negotiate a step or stairs. After completing this safely, you are ready to be discharged from hospital if you are medically stable. We will discuss and arrange any equipment you require for home and discuss your physiotherapy follow-up plan. As mentioned previously, you will generally be in hospital for a total of 3 to 4 days after your operation. In addition to walking, you will be provided with some exercises that are essential for your recovery. It is important that you practice each exercise. It is normal to feel some discomfort during and after completing these. By working hard and practicing regularly, most people are able to regain good movement and strength. We generally encourage people to practice the exercises between 3 to 5 times per day. We will provide you with a sheet that outlines these. We will now go through the exercises. You may like to practice yourself as we go through them. The first exercise is the foot and ankle exercise, where you should pump your feet backwards and forwards. You should perform this exercise on both feet and aim to start as soon as you remember when you wake up following your operation. This helps to get your circulation going to help prevent blood clots from forming. Aim to do at least 10 pumps of both feet every hour that you are resting during the day. The next 5 exercises should be practiced when you are lying on your bed. Practice gently bending your operated leg by sliding your foot along the bed towards your bottom. You may use your hands to help with this exercise. A mild stretching in your hip is normal. You should aim to bend your leg as far as is comfortable. To complete the static quadriceps exercise, tighten the muscles on the top of your thigh by pushing your knee down into the bed. Keep your knee as flat as possible and hold for 5 seconds and then relax. To practice the static gluteal exercise, squeeze your buttocks together and hold for 5 seconds, then relax. Next, roll up a towel and place the roll underneath your knee so your knee is resting on the towel. Straighten your knee and lift your foot off the bed while keeping the back of your knee on the towel. Hold for 5 seconds and then gently lower your foot back to the bed. Remove the towel at the end of the exercise. The bridging exercise assists in strengthening muscles around the back of the hip and back of the thigh. Bend both of your knees so your feet are on the bed. Dig your heels and elbows into the bed and try to lift your bottom off the bed. Hold for 5 seconds if you can, and then slowly lower your bottom back onto the bed. The last exercise should be practiced when you are standing, holding onto a firm surface for support. Ensure you are standing up tall so your legs and body are in a straight line. Next, move your operated leg out to the side, away from your body. Make sure you keep your toes pointed forwards and don't lean your trunk to the side. Hold for 3 to 5 seconds, then slowly lower your leg back to the ground. It is a good idea to practice the exercises before the operation so they are familiar to you.
Generally, patients discharge straight home. However, if you require assistance on discharge, this will be discussed with you and your treating team, and you will be seen by one of our discharge planning nurses. In order to plan your safe discharge, we will ask questions about your home environment and support. This is so we can advise on any assistive equipment you may require. It also allows us to assess and practice any skills that you may need to safely leave hospital. Your admission with us is a coordinated, individualised approach involving you and the treating team, which will ensure a safe and timely discharge.
You will probably need some additional equipment when you leave hospital after your operation. Your physio can assist you to organise the hire of equipment, for example a frame, walking stick, toilet seat raiser or shower chair. Please note that if you are from the country, it may be easier to organise your equipment locally before admission. Ask your orthopaedic admission nurse for advice on what you will need prior to your operation if this applies to you. You cannot drive for the first 6 weeks following your surgery. You will need to discuss this with your surgeon before resuming driving your car again. Your recovery will take at least 6 to 12 weeks, and you should discuss with your surgeon before you resume work and other physical activities. Continuing with your physiotherapy and walking program over this time will help you to optimise your recovery. We hope you have found this information helpful, and we look forward to meeting you when you have your surgery.